go. Okay. So, we're going to talk about bioidentical hormones and the different types of delivery methods as well. So, um, we're going to talk about the benefits and the practical considerations for each method. So, we have a lot to cover, but first we're going to define what makes hormones bioidentical. And that basically, and then we're going to dive into the five main delivery methods available. Each method has its own unique advantages, disadvantages. There's no one size fits all. Um, and more importantly, we're going to discuss safety considerations, practicality about oral hormones, and then we'll have time for questions at the end too. So, okay, so what are bioidentical hormones? They are something that is molecularly identical or chemically identical to what your body produces. So this is what distinguishes them from bioidentical some from synthetic hormones. Um, so these hormones have the exact same chemical structure as what your ovaries, your testes, your adrenals produce naturally. And we're talking about estrogen, progesterone, testosterone. These are the three sex hormones. Men and women have all three, just in differing amounts. So these are all derived, the bioidentical hormones are derived from plant sources, specifically, wild yams for women. And because they're identical to your natural hormones, your body recognizes and uses them as your own. Whereas synthetic hormones like Premarin and Provera have different molecular structures and they just behave differently in the body. And it also takes a long time, like up to 6 months, to get rid of those synthetic hormones out of the body. So beyond symptom relief, many people think that hormone therapy is just about stopping hot flashes and night sweats, but optimal hormone levels really support your entire body's health and longevity. So we're going to spend the next few slides discussing these broader benefits. Hormones are master regulators. They affect nearly every organ system. And when we restore hormones to optimal levels, we're not just treating symptoms, we're supporting overall health. So think of this as sort of preventative medicine, not just symptom management. So first of all, bone and muscle. Estrogen is really critical for maintaining bone mineral density. Women lose up to 20% of bone density in the first 5 to 7 years after menopause without hormone replacement. This significantly increases future fracture risk. Hip fractures can be life-threatening in older adults. Testosterone builds and preserves lean muscle mass in both men and women. And progesterone isn't just for the uterus. It activates osteoblasts, the cells that build new bone. And together, optimal hormones prevent sarcopenia, which is muscle loss, and frailty as we age. As we age, our muscles are naturally trying to turn to fat, and so the testosterone is something that sort of counteracts that. And so this means, better mobility, independence, and quality of life for later years. And just on a side note on progesterone, it used to be we were taught that if you don't have a uterus, you don't need progesterone, and that is absolutely false. We have progesterone receptors all over our body, and we need it to balance the effects of estrogen. So, skin, hair, and collagen. Collagen is the structural protein that keeps the skin firm and youthful. Estrogen directly stimulates collagen production and maintains skin thickness. So without adequate estrogen, the skin becomes thinner, drier, more prone to wrinkling. Get that crepey skin. Skin elasticity depends on these adequate hormone levels. Hair follicles have hormone receptors. So declining hormones can contribute to hair thinning in both men and women. And wound healing, it's also slows with age, partly due to declining hormones. Many patients report visible improvements in skin quality and hair growth within months of starting bioidentical hormone therapy. All right, cardiovascular and vascular health. This is one of the most important benefits, especially when started early in menopause. Estrogen keeps the arteries elastic and flexible, like rubber bands that can expand and contract. Without estrogen, arteries become stiff and rigid, like old dried out rubber bands. I believe this is true of the testosterone too. It also contributes to keeping the arteries nice and elastic. But estrogen is supporting the endothelium, which is the inner lining of the blood vessels that regulate blood flow. It helps maintain a healthy blood pressure and reduce inflammation in vessel walls. And the timing hypothesis is critical. So starting estrogen within 10 years of menopause slows cardiovascular progression or protection. So this is why we emphasize starting therapy early and not waiting until symptoms become severe. Okay, brain and cognitive health. Um, Brain has abundant estrogen receptors, especially in the hippocampus, which is the memory center, and the prefrontal cortex, which is our executive function. Many women experience brain fog during menopause, so this is real and hormonally driven. Estrogen supports memory consolidation, focus, and mental clarity. And studies suggest that estrogen therapy started early in menopause may reduce Alzheimer's disease. Testosterone is equally important for brain health. Low testosterone is linked to depression, reduced motivation, and cognitive decline. Hormones support BDNF production, and that is brain-derived neurotrophic factor, which is like fertilizer for brain cells. Neuroplasticity, which is the brain's ability to form new connections, depends on adequate hormone levels. Patients often report improved mental clarity as one of the first benefits they notice. Okay, here's where you can see my slide making ability has fallen again because I couldn't make this background black to match the other slides. But basically, and this is something, so just FYI, I'm taking a course on reversing early cognitive decline, early Alzheimer's disease. It's called the RECODE protocol. It's by a doctor named Dr. Dale Bredesen, who wrote the book called The End of Alzheimer's. And he also has a new book out called The Ageless Brain. I highly recommend both of those books, especially if you're interested in anything related to cognitive issues, or dementia, Alzheimer's, that type of a thing. Invaluable. Um, and so a lot of the training in this brain, kind of rejuvenation program, talks about oral health. And I didn't realize this until recently, but perimenopause and menopause can actually worsen breathing patterns. It puts you more at risk for obstructive sleep apnea. As estrogen and progesterone decline, upper airway muscle tone declines, making the airway, more likely to narrow and collapse during sleep. And then progesterone is also helping support the brain's drive to breathe. So hormonal decline can disrupt normal breathing regulation and contribute to disordered sleep disordered breathing. And this helps explain why it's more common to have sleep apnea after menopause, even beyond changes in body weight. Okay, so delivery methods. So now that we understand uh, why optimal hormones matter, let's discuss how to deliver them. So we have five main options: creams, pellets, injections, troches, and oral pills. So each has a specific role, and some work better for different patients. We're going to expand in the next several slides, breaking down the pros and cons of each method. And the goal here is to help you understand which might work best for you and your lifestyle preferences. But remember, we can always adjust or switch methods if the first choice isn't optimal. So, and this sort of shows a distribution. This is the one I just threw this in, but I like this graphic. But it shows sort of like how the different methods of delivery kind of will just, and we'll come back to this slide in a minute. So let's talk about creams first. Creams are applied directly to the skin, absorbed through the bloodstream. The biggest advantage being that they're bypassing the liver, so they don't have that what we call first pass metabolism, meaning that they're not changed in the liver. So This matters tremendously for safety, which we'll discuss more later. Dosing is highly adjustable. We can fine tune your dose. And it's something that you're putting on a daily basis. So it's obviously non-invasive. So that's very appealing for a lot of people. Um, for testosterone in men, they can put this on the scrotum, and that really gets better absorption than just on the skin. It's and just like women can do a vaginal cream, and that will absorb a lot faster than if it's on the arm or leg. Um, and so again, it's non-invasive, and if you have any kind of weird side effects, you can always stop, and the levels will drop off within a day or two. So a lot of people do prefer this because of the control that it offers. Disadvantages, the main drawback is daily consistency is required. You've got to remember to put it on. That, when I first started this journey and I started doing creams on myself, that was the biggest kind of hurdle I had to get over. It was like I would forget to do it so often. Um, However, for me, when I was putting creams on, even when I was consistent with it, it didn't make a difference for me as far as my energy levels went. I really couldn't tell if I was on or off it. Now, everybody's different. I was not having hot flashes or night sweats. And so for me, the creams just were not as effective as the pellets. Okay. There's also another drawback is, you might get the cream on somebody else. So children or partners or pets could, touch the area where you put it on externally and potentially get some. Absorption rates can vary depending on where you're putting this on. And that's mainly the main drawbacks on that. Oh, the other drawback, I guess, is that you have to do a different method of testing for if you're doing cream delivery method, because the creams are not going to show up with any kind of accuracy in your blood or serum. So you can't just follow serum levels if you're doing a cream delivery method. You really need to do a dried urine test. This is where you pee on these special strips of paper throughout the day. You let them dry, you send it into the lab, and the lab is looking at sort of the breakdown products of the estrogen, progesterone, testosterone. And that gives us a much more accurate view of what's going on in the at the tissue level. Okay, next we come to pellets, which are probably my favorite. And it's my favorite because, like I said, I started this journey. I did creams on myself for about a year, and I couldn't really tell if it was making a difference or not. I was still really fatigued and run down. Once I started doing the pellet, though, it was a night and day difference. It was all of a sudden I had energy again. I felt more like my normal self. I wasn't dreaming about when I was going to take my next nap. It was just a real game changer. Yeah. Did you have a question?
No,
Okay.
I was just laughing at your comment. That's all.
Okay. Yeah. Yeah. Um, I have to put a pause right here because not all the pages printed up. So I have to get the rest of my pages off the printer. So sorry, we'll edit this little pause out. Sorry.
All right.
Okay. All right, thank you. All right, so obviously, pellets, they are like rice-sized pieces of compressed testosterone. They get placed under the skin, usually in the hip or the flank area. Um, they provide consistent, steady hormone release for the next 3 to 4 months or 3 to 5 months, depending on men or women and how much you're using. Um, this is great because once your pellets are in, they're doing their job. You don't need to remember to do anything except take your progesterone at night, which we'll get to in a minute. But studies have shown that these pellets deliver more consistent hormone levels than any other method. They're bypassing the liver completely, just like the creams. Um, Research comparing pellets to patches found that pellets provide twice the improvement in hot flashes. Complication rates are very low, less than 1% in studies of over 1 million insertion. And then a lot of busy patients just love the convenience of only thinking about it 3 or 4 times a year. Um, and the other nice thing about pellets is that you can accurately follow the blood or serum levels of what your hormones are doing. So blood tests are far easier to do. And the dried urine test, it's not that it's hard to do, it's just kind of an extra step, and it's not as convenient as getting your blood drawn. Okay. As far as disadvantages, it is a procedure. Once you know, and for me, the putting the pellets in takes less than 5 minutes. It's pretty quick and easy. But once it's inserted, you can't get it out. It's just got to wear off. So, this for some people is a little scary thought, like, oh, once it's in, it's in. We can't do anything about it. Um, there can be an initial surge of hormone levels right after the placement. And there's a small risk of infection or pellet, pushing out or bruising. Those are kind of the main issues. It's definitely not ideal for someone who is um, concerned about like if they want more control over their hormones, I guess, or if they think that they're going to need a lot of adjustments. It is so anyways, that is that. So injections. This is a lot of men are doing testosterone injections, with these low T centers. They can be intramuscular in the muscle or under the skin, subcutaneous. Um, this is nice because it bypasses the digestive system completely and the liver. Bioavailability is excellent. And it's easy to adjust the dosage based on blood work or symptoms. And typically, they have been administered every 1 to 2 weeks. However, I always recommend to do more frequent injections because with the pellet, your levels kind of come up and they're just nice and they're plateaued and they have a gradual decline. With the injections, you're going to feel your levels kind of go like this, like a roller coaster. So if you can spread out those injections, you're going to have a little bit more even distribution. Um, Disadvantages, needle phobia. Some patients don't like needles. Um, Even subcutaneous injection can be a little painful. Hormone levels can really fluctuate between the doses. So again, injecting 2 or 3 times a week, maybe you may get better results than just doing it once a week. Um, And the other disadvantage, I guess you just have to stick yourself. You can also get these injection site reactions of just like a little redness, swelling, irritation. And then testosterone has to be dissolved in an oil. And there's a variety of different oils, everything from like an olive oil-like substance to a cottonseed oil to, just a variety of different oils. And so if people are having reaction to the testosterone, it's usually the oil that they're reacting to, not the testosterone. So, but despite these issues, a lot of patients do very well with injections and enjoy those. All right, troches. I'm just going to say off the bat, I don't. really like troches, and I'll tell you why in a little bit. But these are like lozenges that you put under the tongue or between the cheek and the teeth, and it just dissolves. And the idea is that it's absorb the hormone's going to absorb through the mucous membrane in your mouth and get directly into the bloodstream. So theoretically, that should bypass the liver and, first, avoid the first pass metabolism. They're easy to use. There's no needles, no procedures. However, the disadvantages are that a lot of it is actually swallowed. You can't, you try not to swallow it, but it just, that's physics. It just has to be done. And so by swallowing it, you're still, it's like taking oral estrogen or oral testosterone, which is causing a lot of liver inflammation. Um, so that is and then you can't eat or drink or talk much during the 15 to 20 minute of it's dissolving in your mouth. Um, a lot of patients don't even follow the proper technique, or they chew it or swallow it too early. Um, and so again, you're having that liver inflammation. Um, okay. And then oral pills. First of all, the only one that's safe to take by mouth is progesterone. Do not take estrogen or testosterone by mouth because it's just not very effective, number one. But number two, it's causing liver inflammation, which is going to cause things like high blood pressure, weight gain, high cholesterol, like all these kind of bad side effects we don't want to do. So this one, so oral progesterone, it provides excellent protection for women on estrogen. The nice thing is with oral progesterone is that when it gets broken down in our body, in our stomach, it mimics GABA, which is a very calming neurotransmitter. Um, so it really helps with a good night's sleep. Um, let's see. All right. So why are we talking about avoiding oral estrogen? Again, um, when estrogen goes to the liver, it can cause inflammation. Um, Clotting factors increase, triglycerides will increase, C-reactive protein, which is an inflammatory marker, increases. Um, and research clearly shows that oral estrogen increases cardiovascular risk compared to transdermal application, meaning across the skin application. Um, Okay, so, and why avoid oral testosterone? Similar problems to the oral estrogen. It is disrupting normal liver enzyme production and function. It's increasing cardiovascular disease risk. It can negatively affect cholesterol and lipid profiles, and the liver stress is simply unnecessary when we have safer alternatives. Okay, I think I've beat that dead horse to death. Um, so let's summarize what we learned, just a quick comparison. So best for compliance, I think, is pellets. You literally can't forget because it's already done for you. Most adjustable is the creams. And best bioavailability, I don't know if I honestly, injections, I guess, because you know what you're getting. The problem with the injections, I feel, is just the short half-life of it. Um, And, so you just want to think about your lifestyle preferences and which disadvantages you're most willing to accept. So there's really no universal best method. It's sort of like what is best for you. So you want to consider lifestyle, like how frequently do you travel? Are you at home a lot? Daily routine. Creams are a daily application, if not twice a day application. So if it's hard for you to remember to do things like that, pellets might be a better option. Medical history, like some conditions might favor one method over another. And we have to take into account treatment goals, symptom relief, all that kind of stuff. All right. Safety guidelines. And I want to emphasize one more time, just never use oral estrogen or testosterone because the liver risks are unacceptable. Or oral progesterone is the only one that's safe to take. We monitor your levels regularly, and initially, we're monitoring it like the first round of, initially we're monitoring things a lot more closely. And then once you're stable, every, I would say 6 to 12 months. Sorry, I should fix that. And I'm looking not just at numbers, but effectiveness. Like, what are your symptoms? Dosing's very individualized. Some people need more, some less. And I'm not just trying to get you in the normal range, I'm trying to get you optimal, but that's not just the numbers, that's your symptoms as well. Okay. And